If you have a puppy at home or you're rethinking about adopting one, there is a disease you must know about. A silent, aggressive, fast-acting disease that still kills thousands of puppies every year around the world. Its name is and the scariest part, most dog owners only learn about parvovirus when it's already too late. When the puppy stops eating, when vomiting begins, when the stool turns bloody, or when the veterinarian gives that serious look and says, "We need to act immediately." But this video is not here to scare you. It's here to prepare you. Because when you understand how parvovirus works, you can identify the disease early, and early action saves lives. Today, we're going to talk about parvovirus in the clearest, simplest, most understandable way possible. No confusing scientific terms, no complicated explanations, just the essential knowledge that every dog owner needs. You'll learn what the disease is, how it spreads, who is at risk, the early signs, the severe signs, how the disease progresses, how treatment works, what to do immediately if you suspect it, and how to prevent it entirely if you love your puppy. Stay with me until the end. This is one of the most important guides you will ever hear. What exactly is parvovirus? Parvovirus, also called canine parvo, or CPV, is a viral disease that attacks the body in extremely aggressive ways. The virus has three major characteristics that make it so dangerous. 1. It is incredibly resistant. Parvovirus can survive on floors, in soil, on clothing, on shoes, on food bowls, on hands, even on dust particles. And here's the shocking part. It can survive for months, sometimes even more than a year, in the environment. Regular cleaning products do not kill parvovirus. 2. It targets fast-dividing cells. The virus destroys cells in the intestines, cells in the bone marrow, cells in the immune system. This causes severe diarrhea, bloody stool, dehydration, weakness, collapse of the immune system, risk of sepsis, body-wide infection. 3. It affects puppies the most. Puppies don't have a fully developed immune system. They are fragile, and their bodies cannot fight the virus on their own. This is why parvovirus is so deadly for them. How do puppies get Parvovirus transmission is shockingly simple. A puppy can get infected by direct contact with feces from a sick dog sniffing contaminated ground, stepping on infected areas, contact with contaminated shoes, touching food, bowls, toys, blankets, or hands, contact with clothing that touched contaminated surfaces. And here's a frightening detail. The virus does not need visible stool to infect. A microscopic amount, something you can't see, is enough. Another scary fact, even after a dog recovers from parvo, it can continue shedding the virus for weeks. This is why puppies should not walk outside before completing the vaccination series. Which dogs are most at risk? While any dog can get parvo, some are at much higher risk. 1. Puppies between 6 weeks and 6 months, they are the main victims. 2. Unvaccinated dogs, this is the biggest risk factor. 3. Newly adopted puppies, stress plus environmental change equals low immunity. For certain sensitive breeds, some breeds tend to have more severe cases: Rottweiler, Doberman Pit Bull, German Shepherd, Labrador, English Springer Spaniel. 5. Puppies in multi-dog environments, kennels, shelters, pet shops, parks, and homes with many dogs increase exposure. Early signs of parvovirus. Recognizing the first symptoms is what saves lives. Parvo has 3 main classic signs: vomiting, diarrhea, often bloody, extreme weakness. But before these severe symptoms appear, there are early warning signs that many people overlook. Let's break it down by stages. Stage 1. Early warning signs. First, 24 to 48 hours. These symptoms are mild but extremely important. Puppy becomes quiet, stops playing, eats less, sleeps more, shows sadness or depression, slightly warm belly, mild nausea, avoids movement. These signs are often confused with tiredness, stress, adaptation to a new home, being spoiled. Normal puppy mood swings, but they may be the first alarm of parvo. Stage 2. Moderate signs for 8-7 hours. Now, the symptoms become stronger. Repeated vomiting, soft or watery diarrhea, dehydration begins, pale gums, puppy refuses all food, belly discomfort, low energy. At this stage, the virus is actively destroying the intestinal lining. Stage 3, severe signs, 3-5 days. This is the dangerous phase. Diarrhea with blood, very foul smell, vomiting, continuously severe dehydration. Sunken eyes, cold paws, white or gray gums, trembling, rapid heartbeat, intense abdominal pain. A puppy in this state is fighting for its life. What to do if you suspect parvovirus? This part is absolutely critical. If you suspect parvo, do not wait. Do not give home remedies. Do not rely on internet tips. Do not give only oral fluids. Do not assume it will pass tomorrow. Parvovirus is an emergency. What you must do: isolate the puppy immediately, go to a veterinarian as fast as possible, tell them all the symptoms, request a parvo test, very quick and accurate, begin treatment right away with parvo. Every hour makes a difference. How is parvovirus treated? There is no medication that kills parvovirus. There is no magic cure. The virus must run its course. Treatment focuses on keeping the puppy alive until the immune system fights off the virus. This includes intensive for fluids anti-vomiting medication, antibiotics to prevent secondary infections, electrolyte correction, anti-nausea drugs, pain control, nutritional support, plasma transfusions. If needed, hospitalization and constant monitoring. Puppies treated early have a much better chance of survival. Puppies treated late face a dangerous battle. How to prevent parvovirus? Prevention is simple and incredibly effective. It relies on 4 essential pillars. 1. Complete vaccination. Puppies must receive 3 to 4 vaccine doses spaced 3 to 4 weeks apart, starting at around 6 weeks of age, and yearly boosters. 2. No walks before full vaccination. This means no parks, no sidewalks, no grass, no pet shops, no daycare. Even a clean-looking sidewalk can be contaminated. 3. Proper home disinfection use. Diluted bleach or parvovirus-specific disinfectants. The virus is extremely resistant. 4. Avoid contact with unknown dogs. Even healthy-looking dogs can carry the virus. Why parvovirus is so emotionally painful? Parvovirus doesn't just attack the puppy, it attacks the hearts of everyone who loves that puppy. It affects tiny, fragile babies, families excited with their new pet, people who weren't informed about vaccines, children who don't understand why their puppy is sick, owners who blame themselves unnecessarily. Parvo strikes fast and unexpectedly. It's emotionally devastating. But knowledge changes everything. Parvovirus myths debunked. Myth 1. My puppy doesn't go outside, so there's no risk. False. Parvovirus enters homes through shoes and clothing. Myth 2. Giving sips of fluid is enough. False. Parvo requires professional treatment. Myth 3. It's just strong diarrhea. False. It is a life-threatening viral infection. Myth 4. Only street dogs get parvo. False. Purebred, well-cared-for puppies get parvo every day. Parvovirus is serious, it's fast, it's aggressive, but it's preventable. And now, you know, the early warning signs, when to act, how to protect your puppy, why vaccination is essential, and how to avoid dangerous environments. Your puppy depends entirely on you and the fact that you're here. Learning already shows how much you care. If this video helped you, please like, subscribe, and share it with anyone who has or is thinking about getting a puppy. Thank you for watching. Take care of your little one with love and attention.